Welcome to Forum 360 for a global outlook with a local view. I'm Leslie Unger, your host today. We are always thrilled when someone chooses to come to Northeast Ohio. Today's guest, some may be surprised, was invited not simply because he chose to come to Northeast Ohio, even giving up life in Denver, Colorado to take this position. He was not invited simply because he is the new CEO of one of Northeast Ohio's crown jewels, Akron Children's Hospital. He is invited because he is in an elite group. There are only 3 other members that I know of in this group. People who answer and answer quickly, email, even from people they have not met before. Welcome to Forum 360, Chris Gessner, since just October 2021, CEO of Akron Children's Hospital. We welcome you not only to the show, but we welcome you to Northeast Ohio.
Thank you, Leslie. It's great to be here. My pleasure to join your show.
Thank you.
And wonderful to come back to the Midwest after about 3 years in Denver.
Well, I'm going to ask you about Denver in a little bit, because my dad always had this dream of living in Denver, Colorado. But before that, I want to ask you, because this applies to everybody, whether they have kids or not, they're in healthcare or not, never having had any introduction or communication with you, I email you one day. You answer me within 10 minutes, and you answer me with a substantial contribution that's not just, walking the fence of being politically correct. You actually gave me substance. So I want to start out by asking you, what is your philosophy on how you answer email? Because some people, they pick and choose. They only answer some people or people they know, or they prioritize. What is your philosophy on how you answer email?
Well, I have to say I do some prioritization because I get quite a few emails. But once I decide to select and read an email, I need to act on it. So I either respond or I forward it on to my assistant or one of the people that work for me because I want action taken on that email.
And how do you decide, because I'm sure you get hundreds of emails, how do you decide, is it something in a subject heading? How do you decide even what email to answer?
It's definitely subject heading or someone that I may know or recognize. If I don't recognize you, I rely a lot on subject heading.
Okay.
Because that's what I have to go on. I do try to eventually respond to all email though. So it's just a timing question of what I prioritize because I have other tasks that I'm trying to get done during the day.
Sure.
But I've just learned from a time management perspective, if you're going to read something, you need to act upon it, because if you don't, a lot of times it gets put on the back burner and forgotten.
One thing that probably hasn't changed, and you work at Children's Hospital, and one thing that probably hasn't changed with children is asking children, what do you want to be when you grow up? So if we go back, to a 5-year-old Chris Gessner, or a 6 or 7 or 8 years old, it seems like people probably today still answer a fireman, a doctor, a teacher, or a lawyer. I don't know how many children would say, I want to be a hospital administrator when I grow up. So what did you want to be when you were little?
Well, I think like many young boys, I wanted to be a football player.
What position? Offense, defense?
I played a little bit of both, but in college I played defense.
Okay.
But I think for the longest time I wanted to be a teacher, and was really interested in working with younger people because I like to have an impact on someone for a long time in their life. That just felt good to me. My grandparents were teachers, and it just seemed like they had so many people that reached back to them and told them what impact they had on their life. So that seemed very rewarding to me. So I think when I was probably 5 through 15, I was going to be a teacher.
Now, As a communication coach, I have a saying that there are no such thing as little things or big things. I think anything has the potential to be big at any moment. So take us back to the summer that you were doing some work around a hospital.
Right.
And by chance, a chance encounter perhaps changed your career path. Would you
Sure.
tell us about that?
So Latrobe Area Hospital was my local community hospital. My dad was a pediatrician who was on staff there. And I had gone to high school close by and had gone on to college and was working in the summer with the marketable skills that I had. I was basically doing manual labor. So I was digging a ditch or planting a tree right outside the main entrance. And this guy in a suit walked by and asked me if I wanted to come in for lunch. He had recognized me from my high school football days and wondered what I was doing at the hospital. So we sat down and got to talking, and he had a lot of small talk about football and how college was going. And then I basically said, excuse me, but what do you do here? And he said, well, I'm the hospital administrator. And at that point in time, I did not even realize hospitals had such a thing. I just assumed that nurses and doctors ran the hospital. But he explained his role and how he interfaced with the community board and that he managed the business affairs of the hospital. And at the time, I was an economics major trying to figure out what was next, still thinking about being a teacher, but perhaps wanting to do something else, not sure. And I remember saying to him, well, what do you like about your job? And he came back and said, I really like the variety. Every day, I meet with different people. I meet with nurses, therapists, surgeons, architects, accountants, the whole world, and all the different people that work in the world seem to work in healthcare. And so every day is different. Every month is different. It just really excites me. And that really is what sort of got me interested in healthcare administration as a profession.
Now, I think the people listening and watching may or may not know that hospital CEOs often in today's world are not physicians. I would say that the skills as an observer and someone that's had the opportunity to work with some people around a hospital, that the skill set perhaps to be a good physician and a good administrator are not the same. So where do those two skill sets intersect? What does being a, quote, good hospital administrator, what does that involve?
Well, I think the first thing it involves is being a really good listener. And I think good physicians are good listeners. When you go to medical school, I have a brother and a father who are physicians, primary care physicians.
So that gene passed over you?
Slightly, yeah, but I stayed in the field, so to
Yes.
speak. It makes for interesting dinner time conversations around Thanksgiving. But,
Imagine.
I think listening skills are really important for physicians because it all starts with a history. And many people will tell you that that's the first step to an accurate diagnosis is taking a good history. And I find that in my role, I'm listening to a lot of diverse perspectives. There's a lot of different experts that work at the hospital, which contributes to that variety we were talking about. But it also makes it challenging sometimes to get everybody aligned and on the same page. So starting with a good understanding of everyone's perspective and then having the patient as the primary focus and making sure we put patients and families first is really what great CEOs do. I do think in hospital administration, it's helpful for CEOs to have an understanding about how all the clinical components work together to create a system of care. And that takes time to learn. You need to be in the industry. You don't necessarily need to be a clinician, but you need to know how the various clinical professions work together to deliver great care.
Would you say that you had a head start? I grew up in a family, my parents had their own business. So I think I understand entrepreneurship a little differently having grown up in it. Would you say having grown up with a father who was a pediatrician, did you have a little head start in understanding, or was that not a help to grow up in that household?
I think it was a big help.
Yeah,
Yeah,
it sounds like it.
And my father did a lot of teaching and training of younger physicians who I also got to know when I was growing up. So I really think it was a huge boost for me to help me be prepared to do a good job when I got into a administrative role in healthcare.
Now, I found a kind of interesting statistic. Among the top 50 hospitals, 54% of the CEOs were physicians. And among the bottom 50 hospitals, 74% of the CEOs were physicians. Help us understand what makes a good CEO. How do we, the general public, evaluate the CEO of a hospital?
Yeah, I think it's probably tough for the general public. As a CEO, I like to stay behind the scenes and sort of lead with the physicians and caregivers. I think people can appreciate a good CEO when they have good experience at the hospital where they go, because leadership is important. A lot of times it's behind the scenes. So I think the feeling, the quality of service, the customer service, the culture is a reflection of the CEO. In terms of their credentials, they can make their way up through the ranks through different paths. It's not one size fits all, but there's really two buckets that I think of. There's sort of managing the team and being able to ask the appropriate questions to your leadership team, delegate effectively, motivate them, make sure they're feeling challenged. One of the things that I focus on that I've learned over the years is people's strengths. Sometimes people talk about weaknesses and strengths. I tend to focus on strengths because everybody has weaknesses. And then I look at the job that needs to be done. And if those strengths line up with that job, I know I have a winner. So that's the people part and the team management piece. Then there's sort of the technical expertise, right? The knowledge of IT, the knowledge of finance, the knowledge of human resources, the knowledge of operations, process improvement. And each one of those are disciplines that you have to have knowledge in. And sometimes people are deeper than others. But the key thing for the CEO is to understand how all of those disciplines interface and link and synergize. And that's what really separates, I think, really effective CEOs from CEOs that are just okay.
Mm-hmm. I often think your biggest challenge is how to use people to their best and highest use, and how to find those fits when they're fit, and that's really just a huge daily challenge.
Agree.
Yeah.
I think matching strengths with opportunities is one of the most important jobs of the CEO.
You said that as a kind of an outside candidate, that it was both a benefit and not to be an outsider, which I assume means to not have been at Akron Children's. Can you explain further?
Sure. I think the benefit of coming from within inside is that you know the people and you know their strengths. So in healthcare, most of the success and execution of plans is through people, like many businesses. So you have a bit of a leg up if you know the people, not just the people that report to you, but also the people that work for them and for them and so forth. So in terms of understanding project teams and who's best to lead those, or driving change and who's best to do that, you have a good sense if you come from within the organization. And that's a bit of a learning curve if you're coming from outside.
Is it ever an advantage to not have those preconceived ideas about people?
Well, that's what I meant by it's good, and it's benefit and not. The drawback is you might have some blind spots, or you don't have fresh eyes. When you come in, if you have fresh eyes, you take a new look at old problems and you may come up with a new solution. So you have that as the benefit. That's why I said sometimes it's a benefit and sometimes not so much.
Now, you said that you missed being administrator of a children's hospital. So tell us, since you're not, I assume, daily, examining children, how is it different being CEO of a children's hospital than an adult only hospital?
Well, I would say what I missed about it was the tremendous community support for children's hospitals. So I was at Children's Hospital of Pittsburgh for 19 years and CEO
But
for
not
my
a Steeler fan, right?
I have to admit I'm a big Steeler fan.
Okay, okay,
Yeah.
as long as you admit it, okay.
Yeah. So I missed the community support that children's hospitals have tremendous connectivity to schools and communities. And that's something that I missed when I was in the adult world in Denver. But in terms of actually running the hospital, I think some of the skills are interchangeable. Children's hospitals tend to have a lot more interface with parents. That's a big part of our world. So is the Medicaid program in every state. So Medicaid is for lower income families. And typically at a children's hospital, maybe 50% of your activity is with children that have Medicaid. So that requires a lot of interface with state officials because Medicaid programs are administered at the state level. So technically those are different. The other thing children's hospitals tend to be are teaching hospitals. So
And it
they're
goes back to your love of teaching.
doctors, right? So I think not all adult hospitals are teaching hospitals, academic medical centers are, but most children's hospitals have a teaching element to them. But I do think, that the skills are fairly transferable, but the enjoyment comes from tremendous community support. And Akron Children's is the perfect example.
It is.
I mean, its name is Akron Children's, but as you know, it supports communities all over Ohio,
Yes.
Canton, Youngstown, Lorain, Amherst, Medina, Hudson. It's a long list, and we're welcomed in all those communities. And that's just a great feeling when you're part of a team or an organization such as Akron Children's.
Today we are talking with the new CEO of Akron Children's Hospital, a jewel in Northeast Ohio, Chris Gessner. I kind of learned by accident that the road to becoming at least a pediatric surgeon is a longer road than becoming a surgeon like for adults. And I've met a couple, and I have found that they seem to have a different personality and temperament than what we think of as, surgeons that operate on adults. Do you find that doctors that work around children are different, or is it just depends on who? It's an individual thing.
Well, that's a tough question. I think generally they might have more patience, I would say. My youngest brother is an internist and my dad's a pediatrician. And I can remember my youngest brother saying, "I'm not going into pediatrics. I need my patients to be more compliant." And so I think pediatricians may have a temperament or appreciation that they have to have the family involved, and it may take a little longer, and there's other social factors that come into play. But that is sort of painting with a broad brush. I've certainly found adult physicians that I've worked with who also have patients and deal with difficult family issues too. So I'm not sure that's a real hard rule, but pediatricians tend to be very family oriented, good listeners, and I think they're very patient people for the most part.
Now, my favorite topic and my least favorite topic, same topic, vaccines. I don't know if it's something that you're at liberty to talk about now because of what's going on with the mandates and the hospital, but you supported a vaccine mandate even when you didn't have to, when it was a choice and you didn't have to, wanting, in my words, the Akron Children's to be a place people felt safe to go. I wondered if you could talk to us about your decision or the hospital's decision to mandate it when they didn't have to from the government.
Yeah, I think it was a very tough decision, but an easy one to make if you're going to prioritize children's health. So when you think about children's hospitals, approximately a third of our patients are unable to be vaccinated. And fortunately, most children who get COVID don't get that sick and require hospitalization. But the children that do tend to be the vulnerable children, or children that are immunocompromised, or children that have other comorbidities. And in my mind, those are our children. Those are the people we're here to take care of. So we need to make sure and do everything we possibly can to make sure we're not spreading that disease or virus, and making sure that those families feel comfortable seeking our care for other problems that they have. And masking and hand washing, they're all important, but that's not everything we could do. We knew the vaccines were safe. We knew they were effective. So the mandate was just a natural next step as a commitment to our values of making sure we're there for every child, not just the ones that are healthy, but the ones that are immunocompromised, because there's no other place for those children to go. I like to use the example. I applauded Starbucks. I think they mandated the vaccine for baristas. And I thought that was a big step forward. But when you think about Starbucks, I mean, people have an option to where they go get their coffee. But kids that live close to Akron Children's that are immunocompromised, they're pretty much coming here because they need to interface with us on a regular basis. So I think the bar is even higher for those of us in healthcare. And that's why we followed through with the mandate.
Do you think that made Akron Children's stronger in the long run, or did that cause problems that made them any weaker?
Well, I have to tell you, we lost some good people. We ended up losing about 66 people that just had philosophical differences, is the way I would put it. And I feel bad because there were some very good people there, people that were committed, highly skilled, and competent. So it was tough for us to go through that. But I think overall, our team, our organization rallied around the challenge, and we came out stronger.
Not those 60 plus people in particular, but when you think about all of the pushback with vaccine, does it surprise you to look at the differences of opinion that there have been about the great development of a vaccination? Does it surprise you? Did it surprise you? Does it surprise you?
Well, what surprised me was how quickly we were able to develop an effective vaccine. And I think that gets lost in the politics. It's really quite miraculous, really. When the pandemic first hit, I have good friends that developed vaccines at Children's Hospital of Pittsburgh, and I can remember talking to them, and they said, the good news, Chris, is we'll get a vaccine. There's other coronaviruses that are circulating that are less severe, but that work has been done on those vaccines. So we'll pick it up and we'll get one, but it might take 3 years. And so it's hard for me to imagine the world right now without vaccines. So it surprises me that people continue to sort of attack the vaccine or not support the vaccine when the data is pretty clear that the vaccine is effective at preventing severe illness for sure.
In the remaining minutes that we have, I'm going to ask you for some 1 or 2 word answers. What is one thing that you know for sure?
I know for sure that I'm a work in progress.
One thing that gives you hope?
Watching Ted Lasso.
Then that saves my question of your favorite binge program. One thing that you wished you would have known when you were 20?
Oh, when I was 20, I wish I would have known how important it is to be able to disagree without being disagreeable.
Who inspires you?
My parents inspire me. Both of my parents.
Make sure you show them this video, okay?
I'll have to try to do that.
Yes. What would surprise us to know about you?
Well, most people don't know. I have told you that I played a lot of sports growing up, but I was also Nicely Johnson in my senior class musical, Guys and Dolls.
Okay. You came from Pennsylvania via Colorado. What surprised you about Northeast Ohio?
how close Akron is to Cleveland. Even though I was only 2 hours away in Pittsburgh, I didn't appreciate the proximity.
Okay. And have you been here long enough to choose a favorite between Skyway and Swenson's?
I've only been to Swenson's. It was very good, so I'll have to try Skyway.
Okay. I have a saying that there's no such thing as little things or big things. They all have the potential to be big. Answering all email, big or little, I say big. Having the courage to give an opinion in a cancel culture world, big or little, I say big. After talking with our guests today, I hope you feel that way about the future of Akron Children's Hospital, with more than 6,600 employees and 468 beds. Big. We thank our guest today, Chris Gessner, CEO, Akron Children's Hospital, who chose to come to Northeast Ohio from the Denver area. I'm Leslie Unger. Thank you for joining us today on Forum 360 for your global outlook with a local view.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.